Okay, so I would like to thank Klaus for giving me the second last talk and not the last talk of the meeting. So I'm very excited about that. And I'm giving a short overview of the data that we collect in the Swiss implant registry about young patients. Occasionally, I do some scientific work for Matties, otherwise I have no disclosures. And we currently overlook about 200,000 total hip replacements in Switzerland for the time period from 2012 to 2022. That's the time we have, in 2012, we have started with the SIRIS implant registry. The coverage is about 98%. And from those, we have roughly 1,400 patients that are younger than 35 age of years, which makes 0.007% of the total cohort. We have 62, we made 3 groups to show a bit the difference. We have 62 total hips in patients aged 10 to 18, 219 to 25, and 1,147 total hip replacements in the age between 26 and 35. And after that, I thought I wouldn't be interested because it matches more the cohort we treat during joint preserving hip surgery. So we have definitely more male patients in this young cohort group, close to 57% compared to 52 female or 52.9% female patients in the general population. Of course, in the older patients, the diagnosis leading to total hip arthroplasty is OA. This changes in those young groups. We have, of course, the total hip OA is still the majority of the patients, but we have a large number of AVN, especially in the younger ones, which are more distributed. So it's more frequent AVN in the age from between 10 to 18 percent-wise. Probably, we don't know for sure, as a complication of medical treatment for a leukemia or other malignant diseases which need chemotherapy or high-dose steroid therapies. It's interesting that still the majority, 45%, have a unilateral disease, so just one hip is replaced, but 37 have a bilateral diseased hip, which one is replaced, and 17% had, at the time of implantation, already the other hip done. So, well, which is quite significant, especially if you look at the blue bars, that the youngest patients, they have quite a high proportion of this bilateral disease already displaced on one side. Component fixation in general is uncemented. We have only 93% are uncemented, and there is only very few cemented cups. We have some cemented stems, some reinforcement rings used, probably special situations, but mainly we have uncemented total hip replacement on both sides. The most frequently used bearing is highly cross-linked poly in 63% of all patients. Most of them combined with ceramic, some of them is metal, but I think the highly cross-linked poly is the crucial factor in this situation. We have 1/4 of the patients have ceramic on ceramic, and 13% have normal polyethylene, which reflects the trend we have seen the discussion just this morning. So highly cross-linked polyethylene is probably the key factor. We have only 3% cemented stems. Of the uncemented stems, which occur in have been implanted 96%, roughly one third are short stems. We have cemented cups, interestingly, and there are 54 cases which have a dual mobility cup. The revision rate overall, 60 of those 1,409 patients or hips were revised, which is 4.3%. We had The SIRIS has any documentation of the revision in the youngest age group between 10 to 18. There are 9 revisions in the age group between 19 to 25, and the majority occurs in the age group 26 to 35. The cumulative incident rates for different diagnoses. Here is first shown on the control group. The blue line is loosening. Then infection is the yellow line, and all the others not that important. In the young patients, it looks similar. Again, the blue line is loosening. Infection is very rare. And we have only implant failures. The red line is very rare. There were only one case in 2 years after implantation and 4 years after implantation. That's why the line ends and stops at this time frame. If you compare the overall revision risk on the Kaplan-Meier curve, it's not that different. So the control group, we have 5.2 in the general population, in the young patients 6.8. As you can see, the confidence intervals overlap, so that's not significantly different. The trend is a bit higher. It's going to be interesting to observe this curve in the future. If you look at those 3 groups, of course, the flat line down there is the youngest patient group, 10 to 18, they have had no revisions, and the others have the overall 6.8 cumulative revision rate after 10 years, and I can't read it from here, 7.5 for the age group between 19 and 35, and the 7% after 10 years for the oldest group of patients group in 25 to 35. Losing of the acetabulum is more frequent in young patients than in older patients. It's the most frequent complication or diagnosis leading to revision. It's 16% compared to 10% in the older population. On the other hand, we have less loosening on the femoral side and less infection in those cohorts than in the general population. Revision performed complete exchange in 13% of the patients, which are 8 patients overall. Revision of the acetabular side in 1/3 of the patients, including head revisions, and revision of the stem in about 20%. What does this tell us? Well, we can see that the revision rate is not that elevated as we would expect in this young patient cohort. However, we don't know, with all the registry data, we don't know how the hips function, so we don't take proms. That's going to be in the future, in the next 2 or 3 years, we should start collecting proms in the Swiss registry. In the youngest group, on any group, we have information on the disease leading to AVN. We suspect that previous chemotherapy due to malignant disease, but also age may influence the indications for revision, that maybe a surgeon is more reluctant to do a revision in such a very young patient and may rather wait and sit out the problem. The results are adjusted mortality rate, but still, the data always lags a bit behind. So for the last year, we don't have the complete mortality rate dates. So this may be a little bit underestimated. So in summary, there's only a small population who gets total hip replacement in Switzerland. The younger the patients, the more likely the diagnosis of AVN is prevalent. The overall revision rate is 4.3% in this cohort. The most frequent reason was acetabular loosening, and no revision in patients between 10 to 18 years. The unknown reason, it may be just a statistical happening that's because it's still a rather small group. Thank you very much for your attention.